Okay, this is again for student nurses who are planning to go for their clinical placement. When you go for your clinical placement, make sure you write down your objectives for 2 weeks, because I assume everyone has got their placement like 2 weeks. Sometimes you may have 4 weeks, that's different. But if you have got 2 weeks, make objectives for every single day and just show it to your clinical facilitator or your preceptor or your mentor so that they know exactly how to guide you. Let's say you want to do vital signs. Okay, at least 2 or 3 vital signs. Just do it on the patient. Also, make sure you can do some neurological assessment. You can do some neurovascular assessment. Yes, some procedure, just sometimes there may not be any procedures, but just for your experience, take piece of paper or take some assessment tool from the particular facility and tell your buddy nurse who is your mentor or your clinical facilitator, would you mind if I do this procedure on this patient? It's not going to harm you. But thing is that sometimes you don't have to document, but this is for your experience. But do not give any injections or IV fluids. Okay, so this is something to get experience how to fill the document, because so far you have just prepared for your OSCE exam. You haven't seen any real patients. So when you go to your placement, take the maximum advantage of that. Some students I have seen, they just come because they need a signature to finish the clinical placement. No, please stop. It is not just the signature or the hours you complete. Make use of those hours to be fruitful. Get every bit of experience, because here you will be shadowed every single day. You won't be left alone. Okay, there is always a registered nurse who is guiding you. You can ask a lot of questions. Sometimes you just shadow your registered nurse. One day, on day one, you just go with her, see what she's doing. On day 2 onwards, tell her that I have observed this procedure. Do you mind if I do this procedure? Ask. Always ask. If you do not ask, I don't think so anyone would tell you to do such things. Sometimes even I have seen students, the moment they enter, they finish their takeover or the handover, they just sit and write. We can do the writing business even when you go home. But at the clinicals, make sure you talk to the patient, you help the patient, you help your buddy nurses. Hope this helps you. Thank you.